Hi interviewees, welcome to the University of Minnesota. We're excited to show you around our multiple rehab hospitals, including our University of Minnesota Acute Rehab Center, as well as the other rehab hospitals that we rotate at. We'll have various residents chat about their experiences and their clinical responsibilities at each hospital.
Hello, I'm Erin Chapuis. We're at Regions Hospital right now. I'd say that the patient population that you get to see here is pretty diverse, and you see a lot of spinal cord injuries, brain injuries, polytrauma, amputations, strokes, kind of anything and everything you get to experience here. And I'd say that one of my favorite things about being here is that there's a great balance of responsibility and autonomy with having a good support system around to balance it out.
Hi everyone, welcome to the University of Minnesota Acute Rehab Center. This is where we see all the zebras, where we see our transplant patients, where we see our LVADs, as well as your bread and butter rehab patients such as your strokes, your brain injury patients, your spinal cord injury patients. This is around a 30-bed unit, and we're going to show you around. Down these two hallways are our patient rooms. Obviously, we'll kind of stay out here just for HIPAA reasons, but this is where we would find our patients when they're not in therapies. Here's our PT gym. This is where all our patients go to work on physical therapy. Here's our OT gym. Here's our social area for our patients to socialize in. This is also where we have family meetings at with patients and their families. And this is our provider room. Hi, Dr. Babcock. This is one of our PGY2 residents, and Dr. Balzer, recent grad, and now one of our awesome attendings. And this is where our residents get most of our work done during the day. This is the CSC, or Clinics and Surgery Center. This is a brand new building at the University of Minnesota where we do a lot of our rehab clinic rotations, where we get a lot of exposure to neurotoxin procedures, interventional pain procedures, sports clinics, and even exposure to PM&R specialties such as cancer rehab here in the Clinics and Surgery Center. Here you can see some of the patient rooms in the Clinic and Surgery Center, as well as the Team Center, where our residents and attendings and our support staff work together. One of the best parts about this area is the collaboration with other specialties, all in one area for our patients.
Hey, I'm Luke. I'm a year 3.
Hi, I'm Aldo. I'm a year 3 as well.
I'm Dylan. I'm also a year 3.
And I'm Tonera. I'm a year 4.
This is the VA. We're in our workroom here. We have our lovely residence tree. Every resident has their own ornament with their face on it. Fun part about working at the VA, one of the things is that I enjoy is that there's a whole group of us here all together, so we get to hang out. We get to hang out with each other during work, which is a whole lot of fun.
Yeah, it's also, the VA is nice. It's a little bit slower paced. It's probably got like the 3rd best workout room of all the sites. You can get lots of good food and supplies at the canteen, and there's no sales tax at the canteen. So a lot of benefits to the VA.
Pros about the VA, we get a lot of procedures here, which is really excellent. We do a lot of our EMGs here, as well as a lot of our ultrasound and musculoskeletal procedures and injections here. The little bit of a slower pace here at the VA is nice because it means extra time is set aside really just for focused education, which is really a luxury that is nice to have, particularly on rotations where there's a lot to learn.
Some of our co-residents actually do the inpatient rotation on SCI and 4J, which is our rehab center.
Hi everyone, I'm Lauren. I am a 2nd year PM&R resident here at the University of Minnesota. I am currently rotating at Gillette Children's. I'd say the patient population, although it is only children under 18, it is very diverse. We see a lot of spinal cord injuries, traumatic brain injuries, deconditioning, general rehab, so you kind of get a good mix of everything. My favorite part of being at Gillette, I'd say, is the support staff is really great. They're really good at telling you what you need to do or helping you get it done, and I really appreciate it.
Thanks for taking the time to listen to some of our residents and their experiences on their rehab rotation. We hope this was helpful. We hope this gives you a general overview of the rehab hospitals we rotate at, the procedures that we get exposure to, and all of the experiences that we get as a resident. Weren't able to cover every single rehab rotation, but we feel this gives a good general overview of the rehab hospitals we go to. In conclusion, I think one of the best parts of our residency experience is that we do get to go to all kinds of different types of rehab hospitals. This gives our residents very good exposure to different types of practice, different rehab hospital systems, so that our residents really understand once they graduate what kind of setting they want to work in. Thank you for your time and have a wonderful interview day.